When I think about why we are here, one image always comes to mind. A young girl sits on a plastic chair in a clinic, shaking, afraid to speak, afraid to be seen, and afraid to ask for help that should already belong to her. I've met too many young girls like her in Lagos. Their fear is not because they are careless. Their fear comes from a system that has refused to give them honest information, safe options, or dignity. My name is Jennifer, and I work with Ward C. Every day, I see how much power a woman gains when she can decide what happens to her own body. And I see how much she loses when that right is taken away. When a girl cannot access contraceptives, her dreams can end before they even start. When a woman already raising a family cannot decide when next to have a child, her ability to work, study, and plan her life is cut down. These are not private problems. These are development issues that affect entire communities. We pretend these choices do not exist, but abortion is happening in Nigeria. What the restrictions do is push women into unsafe, hidden places. I've seen women who end up with infections, long-term disability or infertility because they met the wrong person at the wrong time. And all of this is preventable. Every global health body has said so. The data is clear. Almost all abortion-related deaths can be prevented if services are safe. This is why the STOP guideline mattered. It was never a blanket approval for anything. It was simply a clinical guide to help doctors save lives under the law. But politics, fear, and pressure groups pushed it aside. And when Lagos suspended it, doctors become afraid to treat even the women who are legally protected. I've stood in rooms where medical practitioners refuse post-abortion care because of fear. Not law, fear. And the result is that more women suffer. Marginalized women carry the biggest weight. Women in rural areas, women who cannot afford private clinics, women who hesitate to seek help because they worry about being judged, reported, or arrested. When the criminal code tries to add harsher penalties, it does not stop abortion, it stops safety. It makes even emergency care harder to access. It puts health workers at risk for doing their jobs. So when we talk about reproductive autonomy, we are not talking about politics or morality. We are talking about human dignity. We are talking about lives. We are talking about whether a woman can complete her education, build her career, and raise her family with stability. We are talking about whether Nigerians will finally admit that saving women is more important than holding on to outdated laws. During these 16 days of activism, I want the public, the policymakers, allies, and community members to remember this. Body autonomy is a fundamental human right. There's nothing controversial about saving women's lives. Protecting women is an act of humanity, and we owe them that. My name is Jennifer, and I strongly believe that bodily autonomy should not be up for debate. Safe abortion saves life, STOP saves lives.